Good evening, everyone, and hello to everyone who's watching this later. I'm Dr. Edith Bracho-Sanchez. I lead our external affairs team here at Columbia, and we're so excited to welcome you to another webinar. I have an amazing panel of physicians with me this evening. We're going to be talking all about early intervention and the latest and what's going on with the program. Very quickly, just to give people a few minutes to join at home. Just to remind you, we are continuing to improve and put out as much helpful information as we can on our social media accounts. So please do give us a follow at Kids at Columbia. We also have an amazing newsletter that we put out every month. We will be sending out the link to sign up on the recap email after this webinar. And with that, I do want to go ahead and introduce my panelists this evening. We have Dr. Gabby Paskin, who is a developmental pediatrician here at Columbia. We also have Dr. Sandhya Brachio, who is a neonatologist, and Dr. Amanda Esteves, who is a primary care pediatrician. I'm really just so excited to have all of the areas covered this evening, and I know that you all work so closely together. So welcome. We're excited to have you. Let me go ahead and start. We always like to start right at the beginning. So I'll go to you, Amanda, just to tell us a little bit about what early intervention is, which will be hopefully a refresher for people joining. But some people may not be familiar with the early intervention program. So what is it? What are we talking about?
Thanks so much, and thanks for having me here today, Edith. Early intervention is a federally funded but state implemented program that offers services such as physical therapy, speech therapy, occupational therapy to children from birth to the age of 3 who have developmental delays or disabilities. And it really is the gold standard for how we address developmental delays in this age range. It's an awesome program because it takes advantage of the neuroplasticity of children's brains at this early age and really can change the developmental trajectory of these children. So it is an awesome program that I am very happy to interface with on a regular basis.
Yeah, so tell us more about how you interface with early intervention. For you specifically as a primary care pediatrician, what are the most common reasons that you refer families and children to the early intervention program?
So as a pediatrician, I am constantly screening children's development at every single well child care visit. And when I am noticing delays, it's a conversation I have with parents. And when parents are on board and agreeable, we send them through to early intervention. We make a referral. Just a quick side note that early intervention will function differently state by state, borough by borough, county by county. But here in New York, parents can self-refer themselves, or their pediatrician or anyone else can refer. And so we place those referrals, and then we work with families through the process to ensure that they get connected to services if they qualify for them. Furthermore, for me specifically, because this is an area of interest for me, I've been working with our ambulatory sites to really improve the process of having parents connect and really understand what the barriers are for families in accessing those services.
Yeah, and I can say as a primary care pediatrician who works in our ambulatory care sites that I have benefited tremendously from you doing this work to improve the way that we refer families. So thank you for all you do, Amanda. Sandhya, I want to go to you because you also work closely with early intervention, but you come at it from a bit of a different angle, which is why, again, I was so excited to have all of you together this evening. So as a neonatologist, tell us how you interface with early intervention.
Absolutely. Thanks, Edith. So the babies who we have in our NICU we think about their development from the time that they're born, whether they are admitted to the NICU because of prematurity or surgical conditions or whatever other needs they may have after they're born that they're not able to immediately get discharged home. And so we talk a lot about developmental care in our NICU, and we have wonderful physical therapists, occupational therapists, and feeding therapists that our families and our babies interface with in the NICU. As we are talking about that transition to home, that's when we start to introduce the idea of early intervention to our families. to continue that ongoing support for therapies. And there are certain populations here in New York who are auto eligible for early intervention services. And so we, for example, all babies who are born with a birth weight less than 1 kilo are automatically eligible for services. And so we're talking to families about what early intervention is, what that process might look like that Amanda described in terms of evaluation after referral, how families can interface with early intervention to optimize their baby's development. And so those are things that we're doing in the NICU and talking about how parents can be advocates for their children. And then Gabby and I also have the pleasure of working in our NICU follow-up clinic where we see a subpopulation of the babies who graduate from our NICU. And these children we're seeing starting at about 3 months adjusted age for those born preterm and 3 months of age for those who are born at term. We see them until they're about 2.5, 3 years old at least. And so in our NICU follow-up clinic, we're also doing more assessments to look at their motor function, their language, and cognitive development as they get older. And we always talk about how we work hand in hand with the pediatrician. The general pediatrician has to do a developmental assessment, but also talk about all the other things related to growth and vaccines and so many other things in a short period of time. And we have the opportunity to do, our visits are longer and we're able to do assessments. And so for some of those children, we may interface with early intervention based on the results of the assessments that we do in our follow-up clinic as well.
Yeah, amazing. And I do, want to ask you all about the specifics and the logistics of how this happens and when it happens and where it happens. But before we go to that part of our conversation, I do want to ask you, Gabby, to give us a sense of how you, as a developmental pediatrician, come out this and how you interact with early intervention.
So similar to Amanda and Sandhya, I have a lot of patients who have some kind of delays and are receiving services already through early intervention. So either I'm referring them or their general pediatrician, or we're referring them through the NICU follow-up program to make sure that they can get some kind of services. And as we monitor kids' development, we may say, oh, I wonder if they could have more of this service, or I wonder if we should see if we can add this service. And so we're kind of talking to families or to other people within their early intervention team to see if we can help maximize kids' services, which hopefully maximizes their outcomes.
Yeah, I love it. And it's, having shared patients with you, it's so helpful to have other people thinking as well about what can be maximized, what can be optimized, again, as we all sort of look long term and try to set kids up for success, really. So let's talk about the logistics. Let's talk about the how we're going to do all of this. Amanda, tell us, how does the initial referral and evaluation work?
It is a multi-step process that I think can be a lot for a family to navigate, especially if they don't know what to expect going through it. So when the referral is placed, there's multiple ways that referrals can be placed. A form can be faxed. A parent can call 311. There's actually new and exciting things coming to New York City with parents being able to self-refer on an online portal. So how the referral happens, even just that step, can be multifaceted. Once the referral is placed, the case gets assigned to an independent agency. So independent agencies are contracted by the Department of Health to provide these services, and that agency will reach out to the family with somebody called a service coordinator to start the conversation, ask the parent what their areas of concern are, and to coordinate evaluations. These evaluations happen usually in the child's home, where a therapist will come to assess the level of delay, and then they will have a big group meeting afterwards called an IFSP, or an individualized family service plan, in which they will review to say, what did your child qualify for? How much services are they getting? Then they get assigned therapists, and then they start services. So you can see how it's a very multi-stepped process that can be very cumbersome for families, and it's very easy for families to get lost at any point along the way, and for the process to vary in terms of length of time and the ultimate outcomes of when services start.
Yeah, let me ask you, are children automatically evaluated in all areas of development when you refer? How does that work?
Ideally, when there's a delay in one area, we would expect there to potentially be delays in other areas. And so a comprehensive assessment should be done, but it's not necessarily the case that all areas will be assessed. It's really going to be based on what the parent is saying is an area of concern or what is put in the referral. So one of the best things we can do to really prepare our families is to really discuss what it is we're concerned about and how they can best advocate for themselves. An example I will give is if there's a concern for autism and you're having that frank conversation with the family, that is something the family has to really speak up about because they might not get evaluated for autism specifically or diagnosed with autism unless they are having that frank conversation. I'm sure others can jump in on that point, but the best thing we can do is really prepare our families to understand what the process is and how to advocate for themselves.
Yeah, and we did have a question that just came in. Can the family say, I'm worried about my child's speech. There may be a concern for autism, but I still really want you to look at their fine motor skills, their motor skills. Like, can they still say, I would like a very comprehensive evaluation, even though this is the specific concern? What are your thoughts and guidance there?
My short answer is yes, but I see Gabby jumping in.
No, so all children are going to be evaluated by basically what we call like kind of a teacher. In New York, we call this a special instructor, and they're going to do a comprehensive evaluation of the child in multiple different domains. But it is not, if concerns hadn't been raised maybe about motor skills, they might not see a physical therapist to do a further evaluation of their motor skills unless concerns come up on that comprehensive evaluation. But if the parent's main concern is speech, they will have a speech and language pathologist come see them in addition to that or also comprehensive evaluation, if that makes sense. So it's the area of concern as well as kind of any concerns that come up during the evaluation.
That is so helpful. And I have to tell you, Gabby, I'm like so embarrassed to admit this, but I do have parents who it's tough to figure out like who's coming and going, right? And what is their role. So sometimes parents will say a teacher came, and then other parents will tell me a therapist came, and other parents will, so even for me as a primary care pediatrician, sometimes it's hard to know, like, wait a minute, who's coming, right? So that's super, super helpful. Now, I wonder, either Amanda, Gabby, Sonia, you as well, like how has this process changed? Because I have to tell you, I find myself again, Amanda, with your guidance, specifying a lot more in my referrals. And I feel like I didn't always have to specify so much. Am I right to feel this way? Like, how has this changed with time?
I think from the NICU standpoint, one thing that I have realized having interfaced with early intervention and trying to help families get connected is really, as Amanda and Gabby have said, helping families advocate for their children. And so we do a lot of counseling in terms of saying, we will write on the referral form, this child has an auto-eligible condition with a birth weight less than 1 kilo or has trisomy 21 or whatever other condition might be, or whatever concern that we might have based on our assessment. And I think, that multifaceted approach, there are so many people who are involved in the assessment, and however we can equip families to advocate and speak to some of those key words that need to be said, I think is something that I have incorporated into my practice. And, even things like giving a letter along with the initial referral. So in the NICU, again, for those auto-eligible conditions, children are eligible for something called an interim IFSP, an interim individualized family service plan. And what that entails is that early intervention has 45 days from the time that the referral is received to conduct that long process that Amanda described. And an interim IFSP allows the highest risk children to be able to get some sort of therapies as that 6-week process is kind of taking place. And so I think really helping educate our providers, helping educate our families so that they know to say those types of things in the NICU, giving a discharge summary and saying, give this to the service coordinator or mention this to the therapist or the teacher who comes to evaluate. Those are some of the things that we have changed locally.
Okay, perfect. Now, one more question for you, Gabby, on this, and then I promise we're going to move on to understanding a little bit more about how the evaluation itself works. But if the concern is autism, who needs to be sent to the house?
So, very good question. So, early intervention, again, if there are people who are working outside of New York, the rules might be different for early intervention for how kids qualify. So, I'm going to talk about what we know in New York because I don't know everything that happens in all the other states.
Yeah.
But in the city, if you, or in the kind of surrounding areas, if you are concerned your patient has autism or if the family is concerned, a specific request has to be made for an autism evaluation. That could be flagged by an evaluation team or a already existing therapist. But if the family is concerned or you're concerned, you should bring that up just in case someone else isn't concerned. So autism evaluations are second tier evaluations. Like they're not usually going to happen during the first evaluation that a child has through early intervention. They actually need to have a psychological evaluation. It's usually through an early intervention psychologist or through basically an autism specialist through early intervention to do an thorough autism evaluation to decide if they qualify. And this is just like to explain, like if I diagnose a child with autism in clinic, early intervention still usually does their own evaluation, not always, but usually. And so even if I say that, I will still be like, you need to go ask the EI coordinator to get a psychological evaluation to evaluate for autism. The reason we care about evaluating for autism specifically is that it opens the doors to additional service specific for that we think will help kids with autism. And without that diagnosis through early intervention, kids do not have access to that service.
Yeah. Okay, perfect. Now, the one thing I always sort of try to prepare families for, and I'm sure you all do as well, and definitely please keep sending us your questions. If we don't get to them right now, we definitely will have time at the end. But how do you explain to families what happens during an evaluation? Gabby, I mean, whoever wants to tackle this one, but what exactly happens and how is the evaluator actually determining if a child has a delay? Because it's sort of like a twofold question, right? It's what happens and how do they know if the child is delayed?
Do you want me to take that? Okay. So someone's going to be evaluated by early intervention, and then usually a team comes to the house. It doesn't have to always be on the same day. Let's say you're concerned about your child having a delay in speech, and maybe they come on the same day at the same time, but maybe they come on different days based on everyone's schedule and obviously coordinating with the family schedule. So they are required to do a standardized assessment. That means there are normed data that they are using on some standardized assessment to evaluate a child, right? And from that, they're supposed to come up with some standard score or age equivalent for a child to decide the percent or kind of how delayed they are. And then I'm sure you'll ask this question, and that will help determine whether they qualify for services. There is some flexibility for provider input as part of this evaluation. As we know, kids do not always perform for us exactly as we would like it every time that they are evaluated. So if a kid is having a bad day, but they're taking a history from a parent and the child isn't able to participate as much as we might expect, they are allowed to kind of say, it was really hard for them to participate based on my clinical opinion and provider experience, plus these standardized assessments. I believe this child is X amount delayed, or something like that. Does that make sense?
Yep, that makes total sense. And then once they do determine what percentage delay there is, what percentage actually qualifies them for therapies?
They need a 33% delay in at least one domain or 25% in two or more to qualify them for therapies, unless they have one of these auto-eligible diagnoses that you have well documented for them.
Yeah. Okay, perfect. And I have to tell you, it has been sometimes frustrating as a primary care pediatrician to be concerned about a delay and then find that they're just under that in terms of the percentage, right? And we'll talk a little bit more about advocacy in a minute. But say that your child was evaluated, they did qualify for therapies. Maybe, Sandhya, let's go to you. Give us a flavor of what that looks like. Like, where are the therapies happening? Who is doing the therapies? What can parents expect there?
Sure. So Amanda had described, the initial agency that where a service coordinator might connect a family to the different therapists who are doing that evaluation. And then after that, once the determination is made about what therapies a child would qualify for, they're setting up this IFSP meeting so that the family can understand what services the child would qualify for. So, for example, they might say physical therapy 2 times per week, special instruction or the teacher 2 times per month. And so they will say these are the things that you qualify for based on our assessment. And then the next step after that is to connect with an agency where there are service providers who would be able to provide those specific services. So many times, we are seeing these children, say, for example, at the 3-month visit in our follow-up clinic, they have been referred when they left the NICU, and by the time they're coming to us at that 3-month visit, the family might say, I have been connected, or my child has qualified for physical therapy twice a week, but we have not started services yet because we're still looking for a therapist in our area who would be able to do that. Or they may have started some therapies but not started others. And so all of that really depends on the region. There are a lot of differences, and depending on the borough of New York City or the region outside of New York or even New Jersey and Connecticut more locally in terms of the services that are available. And so that's sort of the broad answer. Another thing that I'm sure we'll talk a little bit more about is that with COVID, one of the benefits of that was teletherapy, in that people were not able to come into homes, and so teletherapy was offered. And so often we are seeing families being offered virtual services, sometimes because they're not able to find a therapist who is able to come in person. Other times it's as a bridge until they're able to find somebody who could come in person.
Yeah. So since you brought up virtual therapies, how well do they work? I mean, I think now, and I'm sure you all have even more of a perspective than I have, how, like, we have a couple years of this going on, right? How well has it worked, the virtual therapy specifically?
I think it can be very variable based on the family and the child. So
Okay.
the plus of virtual therapy is it allows people to get services, obviously, during a health crisis like COVID. And it also has allowed us to give kids services when therapists are maybe not available, as we know that there's a shortage of therapists, at least locally, in pediatric therapists, right? So we don't have enough therapists to see everybody, and that's been allowed. Remote therapy has allowed kids to get more services. But I think it is very hard for many families and children to have kids sit in front of kind of a computer device to participate in therapy. And so that is the complaint that I hear about the most, that they just are having a hard time doing it. So they're not really participating in the therapy. To remember, early intervention was designed as a family training program, not necessarily a direct therapy program, although that's often how it's used. And so if a family member were able to participate or learn some of the skills through a therapist and then use that with the child, that might be a real positive. So I think it depends on how they're being used. But anecdotally, I feel like I hear from families that they're very frustrated with remote services, often just sometimes discontinuing them because they really don't like them and are waiting for in-person services.
Yeah. Okay. And then we did just have a comment come in that it is important to clarify that nothing has changed in terms of parents' rights about requesting receiving therapy services in the natural environment. And this is why virtual therapies is not for all. But there is a lot of pressure for parents to accept virtual or telehealth. I have to say, and thank you for this comment. I have to say, I have heard from families who do feel like they've been pressured a little bit, and perhaps, I mean, hopefully, it is, as you mentioned, Sandhya, about the bridge, right? It's take this for now until we're able to find you an in-person therapist. Now, beyond beyond the virtual therapies, right? And I think you also beautifully walked us through how the process is supposed to work, right? You make a referral and all the things that are supposed to happen after that and how the therapies work. Overall, how well is early intervention working? And let's say here in New York, right? Like we'll just narrow it down to here in New York. How well is the system as a whole working for kids right now? And I know that's a loaded question.
I think there's a lot of parts of that. I think for the children who are receiving the services that they're supposed to be receiving, it works excellently. I think the challenge is getting children to those services. I know for a fact that in some of our vulnerable communities, the amount of children that get to their evaluation or get to their IFSP is significantly lower than in other parts of our city. In our community specifically, it's about 33% lower than in other areas of Manhattan. And so the question is why? Where is the breakdown happening? And I think it's very multifactorial. I think that there are there's a lot of stigma surrounding developmental delay and diagnoses like autism that prevent families from pursuing the evaluations once the referral process has happened. And we've known from our own data when we really tried to understand what was happening that was probably one of the largest reasons that our families weren't making it to their evaluations was either they were declining after they had that initial phone call, or they just weren't answering the phone because it's all of these unknown numbers and unknown people contacting them. So I think we have a lot of work to do to fight stigma and to really help parents understand what this service is for. But beyond that, I think there's other places where drop-off can occur. It's a very large program that's funded by the state, but individual agencies are providing that coordination. So there's lots of parts to your answer and lots of things that we need to work on. But once children get connected, I think it's an excellent, excellent program for our children.
Yeah. Gabby, Sandhya, I'll give you a chance if you want to chime in further. Otherwise, I do have a follow-up for you, Amanda.
No, I would agree. I think for kids who are getting services, it's wonderful. The thing that I think we all see a lot is there can be, again, a delay, even when you qualify for service, finding the therapist who's going to come to the home or the daycare, wherever the child is. And sometimes that can take quite some time based on the type of therapy that we're looking for and where the child lives. And that is unfortunate and frustrating as we all want kids to get access to service as soon as possible.
Yeah, absolutely. Amanda, I did also want to ask you, as a primary care person, in this moment in time in which we're living, there is undeniable fear in immigrant communities. And I wonder how that has impacted or not parents' willingness to allow early intervention into their homes.
Yeah, absolutely. I think this is such an important question. And we don't have the numbers yet, but anecdotally, we are seeing it. We are seeing our patients decline to move forward with an evaluation because they are unsure if a program that is sponsored federally is going to have impact on their immigration status or cause any sort of harm to their family, and allowing people that they don't know or cannot verify who they are exactly into their home. So I do think it's having an impact. I do think that this is a place where telehealth services can be really helpful. I think we can't provide any sort of false hope or reassurance in what can or cannot happen for families, but we can state the importance of this service and how we can work with families to provide these services in spaces where they feel safe and comfortable. Because while a family, it's, beneficial to do this in the home, and that's the kind of the gold standard of how this works, it can be done in a center-based program. It can be done at a religious organization where they feel comfortable and the therapist can come to them. It can be done virtually if they feel like they don't want to leave their home. There's options, but we have to have frank and transparent conversations to understand where our families are and what their fears are and how we can help address them.
Yeah. And we for what it's worth, remain a safe place, right? To have those conversations and definitely try to position ourselves as such. Gabby, I also wanted to ask you, what are the long-term implications of declining early intervention services? And I know that it varies, of course, on the specific delay, how much of a delay there is, but if you had to say in general, with all the things that are going on, with the stigma, with the real fear that we're witnessing in immigrant communities, what are the long-term implications of not receiving services?
Well, there's a lot of studies long term showing children benefit from early access to intensive services like early intervention early in life, and really, as Amanda said, maximizing neuroplasticity and teaching these kids things that are not coming as easily to them. And so we could hypothesize that obviously not getting those services puts these kids at risk. We're not saying that they won't make progress. Most of them will make progress, but they might not make as much progress or kind of reach the potential that we think they could without some support for them and their families. So likely it is affecting kids, and that we're obviously all very concerned about that.
Yeah. It's yeah, it's like a moment of reflection for all of us, right? Like what can we do and how can we help? And I think for me personally, the big thing I try to stress with parents is like we really want to set them up for the school age years, right? Like if they start school and they feel behind and they feel bad about their own abilities, like it sort of sets them up for this, I hate it here because I can't thrive here. And it's sort of like this cycle that we find ourselves in. Let's talk about, and this is sort of the perfect segue. Advocacy. And I think we have a couple of advocacy related questions that are coming in, and definitely keep sending us your questions because we will have time. But Amanda, let's go to you. If you refer as a pediatrician, it's been several weeks, the family has not been contacted. What do you do?
I'm going to go backwards, but in terms of my prep that I found successful to help try to avoid this situation as much as possible. My main things is as soon as I'm putting that referral in, the main point I drive to families is number one, in the next week, any phone calls that come from an unknown number, answer them. Make sure that you don't have a phone blocker for external phone numbers, because if you miss the phone calls, likely they will stop calling after 1, 2. Every agency is different. Everyone has best intent, but these wait lists are really long and they have a lot of people to try to coordinate services for, so they will stop calling after a few attempts. So please answer those phone calls. Number 2 is I give them in the after visit summary a little checklist of what to expect, with a note to say anytime you get a phone call from somebody, write down their name. You're going to be hearing from a lot of different people with a lot of different roles, and it's really easy to get confused about who is who in this process. But if there's one person's name and phone number to remember, it's your service coordinator. Because if you're lost in the system and don't know what's going on next, that's the person that you would call to figure out what's going on. So if I have a patient come to me and they don't seem to know what's going on, my first step is, can we find out who your service coordinator is so we can call them and figure out where you are? If they don't know who that person is or felt like they haven't gotten a phone call at all, then that's where there's a few options. We have some partners that we work with, but you can call basically the DOH early intervention office to see where their service coordinator was assigned, and then call that agency to find out who the service coordinator is. It's very labor intensive, and I think not a reality for many pediatricians, which is why I think we get stuck in the cycle of just re-referring. We say, okay, you didn't get a phone call, I'm going to refer you again. And what we know is if there's already a case open, that second referral will make things take even longer because the first referral has to officially be closed before a second. So it's really about empowering them beforehand to say, answer those phone calls, write down the names and phone numbers of who you speak to, so that if you're having issues, I can help you navigate this along the way.
Yeah, perfect. And I don't know about you, but I always schedule follow-ups. The guy I sort of prefer, but I bring them back just to make sure that things are moving along the way that they're supposed to be moving. Sandhya, I also wanted to ask you, what happens when there is some discrepancy between the amount of concern that a parent may have versus the pediatrician? And, I've had this happen a couple of times where I actually wasn't that concerned about a specific child and their development, but the parent, often the mom, was very concerned. What happens in those cases? What would you advise?
I think, it is really important to acknowledge the concerns that a parent is seeing, and to equip them with the language to say, tell me what your concerns are. Let's talk about, what that might mean for your child. And if I don't have the same concerns, I use kind of different assessments that we have done in our clinic to kind of say, well, look at, what he was able to do when he was lying on his belly. Did you see that he was able to, he was starting to show some signs of wanting to roll over onto his back, or that he was reaching for this, and to kind of celebrate the skills that we are seeing, and to reinforce that they are age-appropriate skills. I think the flip side is sort of sometimes what I see from the NICU standpoint, to be honest, in that families have had a long stay in the NICU. They are done with, they want to kind of have a normal journey at home. And so they say, I've had it with therapists and doctors. I just want to have my baby at home, and I don't want to engage with services at this point. And so I think those are conversations where, to Gabby's point earlier, we then talk about, look, again, celebrating all the things that the child is doing, and then talking about how early intervention and therapists can help optimize that child's development and provide parents the skills and the tools to be able to help the child thrive, in whatever skills that we would want them to be able to achieve.
Yeah, perfect. Um, Gabby, for you, and I'm sure this happens, and you sort of started to talk about this. Let's say we have a child who is getting services, but we're not really seeing improvement. Either the parent brings it up or we notice that there isn't really that much improvement. What do you do?
So I think we see a few different things. So in one thing that you're describing is a child kind of not making the progress they want, or as they get older, we start to see that maybe there are delays in other areas that weren't previously identified. Not necessarily because someone missed something, just that kids are older, they aren't really talking early in life, and all of a sudden, they're getting older and we're concerned about other, like a language delay or something in addition. So families are always welcome to ask their service coordinator to see if they can have additional evaluations at any time during their early intervention process. So it doesn't just have to be at the beginning. There are standardized times when families and their service coordinator and team are supposed to review that IFSP, that family service plan. That's supposed to happen every 6 months. And so they can discuss what services are happening. If more services need to happen, do they need to have other evaluations at that time? But families should feel free to ask anytime to add things in. And so also, therapists can ask, so they can say, part of what we remember is that these are people who are experts in child development, and it may not be their expertise, like it may be a physical therapist, may not be a speech and language therapist, but they know what's supposed to happen, and they too can raise concerns and say, I think we should try to add on this. Let's have them have another evaluation in this area. So I would say if any extra concerns come up, additional evaluations. If there are concerns that they're not making progress, even though they're getting a fair bit of therapy, I think we have to wonder a few different things, like how is the therapy being received, right? Is it remote? Is it not remote? Where is it being received? Who's giving it? Is the child participating? Like all of these kinds of things that may be impacting how therapy is happening or being absorbed. And then I think we also have to think, why are they not making progress? Are they not getting all the therapy they need? Is something else going on? Do they need a further evaluation for something like autism or cerebral palsy, or is something going on that means that they need more than what they're getting, or something different that we have to tailor their services differently? And so again, families can talk to their pediatrician, they can get second opinions outside of early intervention, and they also can just continue to ask for more services and evaluation. It's very powerful when therapists of the child say, I think they need more, right? They're not making the progress I think they need, or I think they need an autism evaluation, or I think they need speech therapy. Like that's a really powerful thing, and that will bring an evaluation. So if other people are concerned in the child's care, that is helpful in getting them extra services.
Yeah, perfect. Now, Amanda, we started to talk about this a little bit, but let's say we sent a child for evaluation or the family, requested the evaluation and they didn't qualify for services. It's been a few months. We're still concerned. How many months is enough to request another evaluation?
So you can always re-refer. And I've heard there's been a lot of back and forth in terms of what I've heard that sometimes you'll hear things like it has to be at least 3 months. My understanding, there is no minimum time frame. You can re-refer immediately after. But sometimes parents will hear that from an individual that they spoke with along the process that you have to wait at least 3 months. That's something I've heard before as well. But my understanding is there is no time frame. You can always request a re-referral. So I just think it's really important to continue to follow up with these children, provide any sort of developmental stimulating strategies that you can provide to them in the interim, and then re-refer when you feel like it's necessary.
Yeah, perfect. And I'm so glad that I asked that because I had heard 6 months, but it always seemed like too long if the time frame of early intervention is really 0 to 3, right? So that sort of felt like a little long. So thank you for that. And we had that exact question come in the chat as we were talking about it. Let's talk a little bit about the transition out of early intervention and what is supposed to happen, needs to happen. Amanda, why don't you tackle that one?
Sure. And I think to your question before about stigma or being labeled along the way, this is one area in which I tell parents that I almost wish that things would stick along the way, because every time your child transitions from early intervention to then preschool to then kindergarten to then middle school, they will have to be reevaluated over and over again, and what they need will be reassessed at each of those stages. So when you are finishing up with early intervention, which is up until the age of 3, and I'll clarify that a little bit, you then transition to CPSE, or the Committee for Preschool Special Education, and those services will now be provided in a preschool setting. It is not necessarily a seamless transition. It is something that if you are enrolled in early intervention, then your early intervention team may start to assist you with the process. They might educate you about what CPSE is. Sometimes they will help the parent to self-advocate. The parent has to essentially, in written or in-person or verbal communication, request a CPSE evaluation from their specific CPSE district. Finding out what that is for you is a little bit cumbersome. So that's what the EI team will help you do, figure out what your district is, where to communicate. But then essentially what happens is the parent is given essentially a list of different places where they can seek the evaluation, and it's very parent-centric. Parents have to kind of self-schedule and coordinate the various evaluations that they need to then move forward in that process. So how much support they get from early intervention in that transition, I have found varies agency by agency, because it's not a requirement of them to fully transition them, but that is basically the process. And when they transition specifically will depend on when preschool starts and the age cutoff of the patient and how close their birthday is to starting preschool. So sometimes EI services will extend beyond turning 3 exactly if their birthday does not align with when school would be starting for preschool.
So give us some, because I also have sort of navigated this really not because I necessarily read it or it was like publicly available and posted somewhere, but because, with time, as you see different birthday cutoffs, you start hearing from patients that their services were extended, right? And so it's tricky. It's very tricky. So give us some examples, Amanda, if you can. And I, hate to put you on the spot, and you can definitely phone a friend, but, tell us some examples of how this works. And we can sort of use the New York City school system, which I think is public school system, I should say, which I think is a little bit clean in the cutoff, right? It's December 31st. And so it's like the calendar year that qualifies kids for each grade, right? So if you're able to sort of walk us through how that works, I think that would be really helpful.
I wish I could do this in a very specific way, because to be honest, I've had varying outcomes with different individuals, and it's a point of clarification that I need myself. I don't know if Gabby or Sandhya can clarify specific.
I can clarify. So if you are receiving early intervention services and your birthday is from January to the end of August, so August 31st, this is where things get really confusing. If a child has had a CPSE evaluation before their 3rd birthday, including their IEP meeting, and qualified for services prior to their third birthday, they will be eligible for an EI bridge until they transition into a preschool program or preschool services, which likely will be September of the year they turn 3. So that means if you are born in January,
Yeah.
and you are getting 20 hours of ABA and speech OTPT, and you have successfully done your CPSC evaluation, you have an IEP signed before your birthday, EI will extend their services until the child is placed in preschool. Let's say the IEP is for them to go to a specialized preschool program where they will get speech OTPT. Okay. It is very likely that that child will transition into a preschool program in September because that's kind of extra confusingness about living in New York City. Okay.
Yeah. Right.
So not everywhere's like that, but we have this extra thing. So EI has made this bridge because that child who was born in January would then be out of services for 7 months, right? And that would not be okay. So they are bridging them. So EI will end for that child who's born in January, who's going to start school in September on August 31st. And then school will likely start after Labor Day or something like that. It is possible, but not super common, that they could transition to school in July. There are just like certain feeding points into preschool, which happen to be September, January, or July. But the most kids go in September, so that's to think about. So we have January through August. So if you are born in the second, like the fall to the winter, so if you're born from September 1st until December 31st, the same thing happens. If you've had your CPSC evaluation and you are eligible for services, have your IEP signed and everything, you can bridge your EI services until December 31st and transition into the CPSC on January 2nd, because January 1st is always a holiday. But to make this extra complicated, if you are born in the fall, you are actually eligible to transition into CPSC early. Like kids sometimes do that because remember, the cutoff date for the school, like this school system, is December. And so kids could potentially transition early. It doesn't always happen because their CPSC evaluation hasn't happened early enough. But if it did, and a parent, and they like had all their evaluations were done and IEP signed, they potentially could transition into a CPSC program in September instead of waiting till January. There's like a lot of logistics around that, but it is possible. So this is why it's very confusing. And I would say very common, unfortunately. I see a lot of kids who kind of lose their bridge and fall through the cracks. And so what I say to like everyone I talk to is like, if you are seeing a child who is around 30 months and is receiving early intervention services, please ask them if they know about the CPSC transition and if anyone has talked to them about that. Because if it hasn't, we want to make sure they're starting to get ready and they can refer themselves.
Yeah, I love it. And we just had a question come in. Can this be presented in a notes email? We can try our best to put this in the wrap-up email after this webinar. And it was super helpful to me to hear you, out loud just say the different dates and with the different birthdays because we have so many families who are in this situation. So for me in primary care, very helpful to hear. For parents, at what age exactly, just to be super concrete, do they need to start requesting that CPSC evaluation if they're receiving early intervention services?
So most kids, my feeling is most kids start to get it around like 2 years, 8 months. But you could potentially get it kind of at around 30 months or 2 years, 6 months. But I think so. When I see 30-month-olds, a lot of families will say like, yeah, they told me about it. Like, I know it's starting to happen, but they haven't had the evaluation scheduled yet. If I had a kid who was in birthday in the fall and the family wanted to transition early, I would be very motivated to be like, you need to do this as soon as possible. Start to talk to your EI coordinator, start to schedule your evaluation, right?
Okay.
And just for everyone to remember though, like as you get closer to 3, like at some point EI says I'm done, right? And those kids can be evaluated by the CPSC early. Like EI is not evaluating 34-month-olds and 35-month-olds. It doesn't matter whether they could bridge or anything. And so those kids can go straight to the CPSC.
Okay. Perfect. Amanda, were you going to say something
I was
else?
going to say the same exact thing, that I think that's what makes it so challenging specifically for isolated speech delays, because really when you start to be delayed enough to qualify is around the age of 2, right? And if you're in this wiggle room, you have until basically 2.5, because beyond 2.5 is when you start to need to transition to over CPSC. So just very nuanced and very challenging, and just important to think about when you're referring families.
Yeah, and plan for, absolutely. We just had a comment come in that there's a tool that families can use to calculate when the transition process should happen. So we can definitely check it out and potentially add it to the recap email from this webinar as well. Let's tackle some questions if it's okay with you all. We've had a number of them come in. So first one, can anyone comment on the ability of services for speech therapy on the availability, excuse me, of services for speech therapy for bilingual children and families?
I will allow anyone to answer, but I would say I think it depends on the language that the child speaks. If you speak second English or another or any other language that is commonly spoken in New York, I think it is very possible to get bilingual therapists, especially if you live in a neighborhood where a lot of people speak that language. If you speak a language that is not as commonly spoken in New York, I think it is harder to find bilingual therapists. Would you guys agree?
I completely agree. I know in our patient population, specifically, English and Spanish has been very easy, but for our patients who speak other languages, sometimes it can be really challenging.
Yeah. We also had a question come in from one of our primary care physicians, Dr. Stevens, who said that many parents are hesitant about evaluations for autism. So she started the evaluation process sometimes solely focusing on speech delay. Is that something that you all have seen, and how do you frame it so parents are more receptive?
I'm going to defer to other people because they come to me willing to usually hear something.
Right. Right.
I think it's very nuanced, and I think it's about building trust and assessing what the parent is concerned about, what their goals are, and building from that conversation. If you have a parent who you're bringing up a developmental delay, generally like a speech delay, and there's already some hesitancy about moving forward, then I would have very close follow-up and slowly have that conversation over time in hopes of not, breaking down trust. I think that sometimes it is more palatable to start talking about speech delay. But that being said, we know the importance of having families specifically ask for an autism evaluation in terms of getting the actual services that they need in a timely fashion. So it is important to, at some point, before they finish with the evaluation, not even finish, they can always ask for it later on, to really have that conversation and say that this is something that I am concerned about. What are your thoughts, and kind of move forward. I don't know if others want to contribute, but I think it's something you do have to bring up. It's just a question of where in the timeline of your relationship and how quickly you're bringing it up for them.
I think that people are, autism is a scary word. No one wants to hear that about their child. And I find that if you can ally with families about them being worried and them also thinking there's a delay, I try to say, I don't think it matters what we call it, as long as we all agree that we're working on it. And that's what early intervention is for. One, if you want a second opinion, let's see them have a second opinion for you, right? That's something we can do. And if you're worried, like this is a way for us to access service, autism is a powerful diagnosis that gives us a lot of access. And that's what we want for your child. And, would you be willing to kind of start on that, and we can continue the conversation over time?
Yeah, perfect. The other question we had come in was, is there a list of developmental pediatricians at Columbia? This commenter said that they always refer to you, Dr. Paskin, but we'd love to spread the love.
Well, there are only 2 developmental pediatricians at Columbia, me and Dr. Nolte. So when you refer to us, you're really referring to either of us, because we work in the same places and our wait list is the same. So the kids would be able to see one of us.
Yeah. Can people from other institutions or community pediatricians who may be joining us this evening refer to you?
Good question. The answer is yes, but it is actually quite challenging to do, because it is hard sometimes to find us. And that's because there's a long wait list and the list is long. So our wait list is probably 6 to 9 months. And so kids have to wait a while to see us. But the answer is yes. If people are interested in referring, we do take referrals from outside.
Perfect. And a really good question, I think. I think from a parent may have come in about what is the difference between an EI referral and sending to a developmental specialist, and is there an age range to refer for each?
I think about them in tandem,
Yeah.
if that makes sense. So one early intervention will do a general evaluation of a child's development. And then obviously, if there's any specific areas of concern, I am not a physical therapist or an occupational therapist or a speech and language therapist or a teacher. And so we need kids to be evaluated by those people to help kind of supplement their evaluation and understand how to target those specific areas. My job as a developmental pediatrician is to like evaluate and follow and monitor kids' development that may not be typical. So in the setting of NICU grad clinic, following kids who are high risk, or in the setting of some of my other clinics, following or evaluating kids who have specific developmental concerns raised by their pediatrician, whether that's speech delay or developmental delay, motor issues, or things like that. So I do not provide therapy. I just provide kind of diagnosis and monitoring and kind of helping families navigate the process and then following them over time and giving advice about services and other medical things that might be going on. But I am not providing services. So we need them to be getting services through early intervention in the school district or privately through insurance, because that's how they're going to be getting the actual work, if that makes
Yeah.
sense.
Yeah, totally. So together, always. Do both, do both. Amanda, another question came in, and I know that this is actually something you've been streamlining and optimizing for all of us who work with you. Is it helpful to send a copy of a child's most recent physical together with the EI referral request? Does it help to speed the process up at all?
Yes, and this is one of those things that has changed. So all children previously also needed a physical form in order to move forward with their early intervention process, but now it's required before evaluations can occur. So it's extremely important for parents to have a copy of their physical form. So as soon as you're putting in the referral, having that, giving that copy to their family is extremely helpful.
Yeah, perfect. I think we tackled all the questions that had come in. I'm really so grateful to have had you all this evening. Parting thoughts. We have a couple of minutes. So when it comes to families sort of navigating the process, advocating for themselves, things that we as primary care clinicians can do better to help this process move along. What are some parting thoughts? Amanda, I'll go to you first.
I'm just really excited to work amongst this group. I think there's a lot of exciting changes and avenues for us to support our patients. I think this is a really excellent service that does wonderful things for children, and there's ways that we can improve to better connect our families, but we're in process.
Yeah. Gabby, I'll go to you next only because you're next on my screen.
I would just say, I think it's really important for us to empower families. They are the people who are dealing with this very complex and overwhelming system, and we are often not there. And so they can tell us what happened, but we really want to empower them to be the best advocates and not to be afraid to ask for the things that we think their kids need and they think their kids need, to help get everything they can.
Yeah, I love it. Sandhya, we'll close it out with you.
I think one of the great things, we are all different subspecialties within pediatrics, but development is something that is core to what each of us does in our subspecialties. And so, we believe wholeheartedly in helping optimize children's development and working in that family unit. That's why we're pediatricians, right? And I think one of the things that we hit on today is meeting the family, helping families advocate, but also meeting the families where they are in that process, and helping, with that counseling. And for some families, they might come to you with a concern, and helping to either allay those fears or help support and help advocate from that standpoint. And other families might not be there yet, and kind of doing that close follow-up so that we can work hand in hand. But just to know that we as pediatricians of various sorts are here to help families and to help advocate, so that their children can thrive.
Amazing. What a wonderful way to end our time together. Thank you, really, to all three of you for taking time this evening to talk to us about early intervention. Thank you to everyone who joined. We will be sending out a recording of this webinar along with a few of the resources that we talked about. And please stay tuned for next month's webinar. We announce it always first, I think, on social, and then we, of course, also send out emails. So just make sure to follow us there to stay in the know of all the amazing things we have coming up. Thank you all so much for joining this evening.